Hello, I am Dr. Kavan, and today's presentation is on Chapter 38 in your textbook, beginning on page 759. This topic is providing wound care and treating pressure injuries. I will present this material to you in two lessons. Part 1 will be an overview of wound healing, and Part 2 will be an overview of wound care. Let's get started. Overview of wound healing. Upon the review of this presentation and reading the content in your textbook, you'll be able to describe the physiologic changes and process by which wounds heal. You'll be able to discuss factors that affect wound healing, describe 4 signs and symptoms of wound infection, and discuss correct nursing actions to be taken if wound dehiscence or wound evisceration occurs. Wounds can occur in a variety of ways. They can be a result from trauma, surgery, pressure ulcers or pressure injuries, as well as burns. They can be classified or referred to as open or closed. All injuries to the integumentary system, or the skin, can result in risk of infection or even permanent damage. Wounds may be open, which means occurring through the skin, or referred to as closed, without a break in the skin. Examples of closed wounds are contusions such as bruises, hematoma, or sprains. Examples of open wounds are incisions, lacerations, abrasions, puncture, penetrating, avulsion, or ulcerations. You can find examples of wound types in your textbook on page 760, table 38.1. Wounds may be referred to as partial thickness, which are superficial, or full thickness. Partial thickness are wounds that heal more quickly because new skin cells are produced by the epithelial cells remaining in the dermal layer of the skin. When a full thickness occurs, the dermal layer is no longer present except at the wound margins. For this reason, the wound healing may take longer in full thickness wounds injuries. How do wounds heal? So wounds heal through phases. Regardless of the cause of the injury or the wound, there are 3 distinct phases of wound healing. Inflammation, proliferation, and maturation are the phases of wound healing. So wound healing begins with inflammation. The inflammatory process includes inflammation which is introduced to the localized injury site or destruction of tissue site. The inflammatory process begins immediately after injury and can last approximately 1 to 4 days. Some signs of inflammation include swelling or edema at the injured site. Erythema, also referred to as redness, resulting from the increased blood supply. Heat or increased temperature at the site can be present. Pain stemming from the pressure or nerve receptors. Possible loss of function can be resulted from all the changes I just mentioned above. The next stage of the wound healing process is referred to as the proliferation stage. This stage begins on the 3rd or 4th day after injury and can last 2 to 3 weeks. In this phase, the wound is filled with new connective tissue and new epithelium, which will cover the wound. Macrophages, which are monocytes that are phagocytic, continue to clean the wound of debris, stimulating fibroblasts, which in turn synthesizes collagen. New capillary networks provide oxygen and nutrients to support the collagen and further synthesis of granulation of tissue, which means the formation of new tissue. The tissue is a deep pink in appearance, and full thickness wound begins to close from contraction as new tissue is grown. Scarring is influenced by the degree of stress on the wound. In 15 to 20 days, there is a risk of wound separation or rupture during this particular stage. The final phase of the wound healing process refers to as the maturation phase. During this phase, it can actually occur 3 weeks after injury and may take up to 2 years, depending on the extent of the injury. Collagen is broken down and resynthesized by the macrophages, which in turn produces strong scar tissue. Scar maturation or remodeling can occur during this phase. Scar tissue slowly thins and then becomes paler in color. Please refer to the concept map on page 763 in your textbook, concept map 38.1, which is a defined outline of the process of wound healing. Additional phases of wound healing can be referred to as first intention, second intention, or third intention. So let's think about the different types of wounds. Let's consider a surgical incision. A surgical incision is made with a nice surgical instrument, right? It would cut the skin with little tissue loss, and the wound bed of that particular incision, the edges are approximate. With this type of injury to the skin, there's a slight chance of infection. Because the edges of the wound are approximate and there is little tissue loss, this type of injury to the skin or wound will heal by what is called first intention. If you have an injury to the skin, such as a laceration or a decubitus ulcer resulting from pressure injury, these type of injuries have edges of the wound bed that are not approximate. They're left open so that it can be filled with scar tissue and begin healing. This type of process is referred to as second intention. Now, third intention occurs when there is a delay in suturing of a wound or delay in wound healing. Such wounds are sutured after granulation tissue have begun to form. For instance, an abdominal wound left open for drainage and then later closed is an example of healing by third intention. In your textbook, on page 764, there are examples of these type of phases: first, second, and third intention. Please take time to review this content. Let's discuss some factors that affect an individual's wound healing process. Factors include age, peripheral vascular disease, decreased immune system function, and reduced liver. For instance, individuals such as children and adults heal more quickly than elderly. Chronic diseases, such as peripheral vascular disease, can impact wound healing because of the impaired blood flow. Individuals who are immunocompromised may also have delayed wound healing. Additional factors include decreased lung function, nutrition, and lifestyle. An individual's lifestyle can certainly impact wound healing. A person who does not smoke and who exercises regularly will have healed much more quicker than an individual who does smoke and does not exercise. Additional factors affecting wound healing are your medications, infections, and chronic illnesses. Medications such as steroids and other anti-inflammatories, heparin, and anti-neoplastic agents can interfere with the healing process. Individuals with infections will experience a slow healing process because of the presence of the infection. Also, as mentioned previously, individuals with chronic illnesses such as diabetes, cardiovascular disease, or immunocompromised individuals may experience slow wound healing as well. We're going to discuss some wound complications. An example is hemorrhage. Some bleeding from a wound site is normal, but hemorrhage is certainly abnormal. As a nurse, please assess your patient for any signs or symptoms of hemorrhage. Look for hypovolemic shock. Signs and symptoms of hemorrhage include decreased blood pressure, an increased pulse rate, increase in respirations, restlessness, diaphoresis, and also the individual can be cold and clammy. Another example of wound complications is infection. A wound may be infected with microorganisms at the time of injury, during surgery, or even post-operatively. Traumatic wounds are more likely to become infected. Localized infection is referred to as an abscess, where there is an accumulation of pus from debris as a result of phagocytosis. There are common microorganisms frequently found in the presence of wound infections. Familiarize yourself with these microorganisms. In your textbook, you can find this figure 38.4 on page 766. This is an example of an individual taking a specimen from the interior of the wound for a wound culture. Additional wound complications include cellulitis, which is an inflammation of tissue surrounding the wound, which is characterized by redness or induration. Fistulas, which is an abnormal passage between two organs or an internal organ and the body surface. And also sinus, which is a canal or passageway leading to an abscess. Wound dehiscence is another example of a wound complication. Dehiscence is the spontaneous opening of an incision. Familiarize yourself with risk factors that put an individual at greater risk for wound dehiscence. These risk factors include obesity, poor nutrition, multiple trauma, excessive coughing, vomiting, strong sneezing, suture failure, and dehydration. The greatest risk for wound dehiscence is on the 4th or 5th postoperative day before extensive collagen has built up. A sign of impending dehiscence may be an increase in the flow of serosanguinous drainage. Be aware of these signs. Lastly, another complication associated with wounds is evisceration. Evisceration is protrusion of an internal organ through an incision. If evisceration occurs, do the following. Place your patient in supine position. Place large sterile dressings which are soaked in sterile normal saline over the viscera. Notify the surgeon immediately and keep the patient NPO as they will return to the OR. Okay, class, it's time for a review. Which phase of healing begins on the 3rd or 4th day after an injury occurs and can last up to 2 to 3 weeks? Is it the first phase, which is A? Is it B, inflammatory phase? Is it C, proliferation? Or is it D, maturation? Take a moment to respond. The correct response here is C, the proliferation phase. This phase begins on the 3rd or 4th day after the injury and can last 2 to 3 weeks. The first phase is also known as the inflammatory stage. It begins immediately after injury and can last about 4 to 5 days. And the final stage of healing is the maturation phase. It begins about 3 weeks after the injury. Question 2. Which of the following is not a factor in wound healing? Is it A, age, B, medications, C, lifestyle, or is it D, type of wound? Take a moment to respond. The correct response here is D. The type of wound does not impact the wound healing. Time for a break. We'll pause here before we continue to section 2.